Empty nose syndrome, or ENS, is a rare but serious condition that occurs after certain types of nasal surgeries, particularly those that reduce or remove the turbinates. The turbinates are structures within the nasal cavity that help to regulate airflow and maintain moisture. When these are reduced or removed excessively, it can lead to ENS. The main cause of ENS is usually surgical procedures like total inferior turbinectomy or aggressive turbinate reduction. About 20% of patients who undergo these procedures might experience this condition. The issue arises because the surgery reduces the surface area inside the nasal passages, which can alter the way airflow is perceived by the brain. Patients with ENS often report a paradoxical feeling of nasal obstruction. Even though the nasal passages may be physically open, they feel as though they can't breathe properly. This sensation comes from the loss of the normal airflow and temperature sensation due to reduced mucosal surface area. Other symptoms can include dryness, a sense of suffocation, and sometimes even psychological distress, as the constant discomfort can be very challenging to manage. Diagnosing ENS can be difficult as it's primarily based on the patient's symptoms and their history of nasal surgery. Physicians may use questionnaires and physical examinations, but imaging like CT scans often shows no clear blockages. This makes ENS a condition that requires careful consideration of patient experiences. Treatment options for empty nose syndrome focus on symptom management. These can include saline sprays and gels to maintain moisture, humidifiers to improve air quality, and even some medications to help alleviate discomfort. In severe cases, surgical interventions, such as implanting materials to simulate the function of the turbinates, might be considered. However, these procedures carry their own risks and are considered after other methods have been tried. Empty nose syndrome can be life-altering, making a once simple act like breathing feel challenging. Awareness of this condition is important, especially for patients considering nasal surgeries. Discussing potential risks with a healthcare provider before surgery is crucial to making informed decisions.